During your pregnancy, you might be asked by your midwife if you've experienced any bleeding or spotting during your pregnancy, and I would like to explain what these questions mean. So bleeding in pregnancy refers to any bleeding from your vagina, and bleeding doesn't always indicate that you're losing your baby or having a miscarriage, but it should always be treated as abnormal and be checked out by a midwife or a healthcare professional. In early pregnancy, you might experience some spots of blood, a small amount of blood coming from your vagina, and this happens usually around the date when your period might be due. And this is because the embryo or your baby is implanting into the lining of your uterus, and this can sometimes cause some of that lining to shed and could cause some spotting. However, if you were experiencing pain and you're worried about the bleeding, then your local maternity unit will have an early pregnancy unit that you can call for advice, or you can contact your GP to ask if you can be referred possibly to the early pregnancy unit, and they may offer you a scan to determine the cause of your bleeding. In late pregnancy, bleeding can sometimes occur with mucus, especially if your body is getting ready for labour. So if you start experiencing tightenings and contractions in your stomach, and you have some mucus leaking from your vagina that's perhaps pink or streaked with blood, this could indicate that your body is preparing for labour, and this can be a normal sign of labour. However, you could call your local maternity unit for advice about what to do next. Sometimes in pregnancy, women can bleed after sex, and this should always be treated as abnormal and should be checked out by a midwife. So sometimes women have something called an ectropion, which is where cells from the inside of the uterus have migrated and they are sitting on the outside of your cervix. These cells can be disrupted during sex and can cause bleeding. However, you would only find out that you have an ectropion if you have these checked out. So any bleeding after sex, please call your local maternity unit and they will probably invite you in, and they will offer you a vaginal examination with something called a speculum, which is a plastic tube that's inserted into your vagina. And the doctor or midwife will shine a light onto your cervix so they can see clearly where the bleeding is coming from. Bleeding after sex is nothing to be embarrassed about, but it should always be treated as abnormal and should be checked out. So as I've said, any bleeding in pregnancy should always be treated as abnormal, and this is especially so if you are experiencing heavy bleeding. So if the blood is trickling, or if it's staining your underwear, you need to seek medical help. And if the blood is heavy and trickling down your leg, for instance, you would need to call an ambulance to go to A&E as soon as possible.